Discovering Health. We've had the opportunity to have some of the best healthcare practitioners around us on a day in, day out basis, and some of the things that we take for granted and things that we know that we take for granted, other people, it's a complete revelation to. So we decided we needed a way to share this information, and this is a part 2 of our series of Back to Balance in Healthcare. A couple of different things I want you to know before we started. We're going to go for about an hour and 20 minutes, something like that.
Yeah.
About an hour and 20 minutes.
Yeah.
We're also, just to let you know, as we go through this, we're going to take questions at the end, so please write down any questions that you have. Over the last year and a half, just a little bit of a prelude is over the last, about a year and a half ago, I tested for the first time. I took the BWA test. And after 20 years of studying health nutrition, I found something that was really crazy. I was actually at a place where I wasn't sleeping well at night. I wasn't waking up rested in the morning. I was having troubles maintaining weight. I mean, keeping weight off. I had no problem putting it on. I just didn't want to stay off. So
beer.
And I started looking for solutions. Also, as a male, I'm 47 years old, and I've been taking a natural testosterone supplement for about 8 years, and they'd stopped
compared
working.
to me.
So I just started to feel old. And when I took the test, my initial thing was, because I got the test, I've taken hundreds of tests and had clinics, and we had all kinds of computerized testing. And I got my first consult with Steve. And I initially looked at it and said, I looked at my test, it looked horrible. I mean, I looked like some of my worst clients. And I said, something's wrong with this testing mechanism. I don't know if it's accurate. But as he started to describe the process, what I found is that I just didn't know what I thought I knew. And as much as I blame drug companies for being the big bad evil people out there educating doctors, I found something else, is that most of my education, when I look back at it, and we're talking about almost 5,000 hours of education in nutraceuticals and in supplementation, 100% of that was provided to me by nutrition companies, supplement companies. So I was no better than the doctors who were being educated by pharmaceutical companies. I was being told to take things because I thought I needed to take them. One of the things that I realized in this whole process is that it's just as bad to take something that I don't need as it is to not take something that I do need. And it's all about bringing your body back into balance. So today, in every topic that we have, either from the work that we do at Human Garage or the biochemical work we do with Pure Ecology, it's all about bringing your body back into balance. And there's no better person to talk about this subject than Steve. Steve's not only has he been in the industry, his family started the pharmacy in Santa Monica. It used to be the only pharmacy there, right?
Mm-hmm.
That was 85 years ago?
72.
72 years ago. Now Steve's not 72 years old.
Almost.
But he's close. But Steve's been working there for 35 years. And not only is he a homeopathic pharmacist, but Steve is a research scientist and he does have a PhD. He has this whole entire program was his brain on paper, and it's really changed my life. My energy levels, the way I look at life, my outlook on life has all changed over the last year and a half. But specifically, it started changing about 45 days after I took his advice. So, without further ado, I'm going to introduce Steve Litvak. Thank you.
Thank you. As you know, this lecture's on hormones, so if you came to the wrong place, you can leave. Okay? Hormones make up everything that the body is. It makes up the shape of our face, the shape of our arms, our legs, our butt is made up of hormones. Of course, we know the breasts are made up of hormones. The size of the breasts come from hormones. Of course, estrogen, one of the estrogens. And our actions, our thinking process, how we treat people, our assertiveness, everything is made up of hormones. So every time we do something, we laugh, we scream, we cry, we punch someone, we yell at somebody, it is a reaction of our hormones. And all the different hormones have different controls in the body, which we're going to learn about as I go through this PowerPoint with you. Hormones are just chemical communicators. Just like how we talk to each other, there's hormones inside of our body which are chemicals that are speaking to other hormones. And they're speaking to enzymes, they're speaking to everything in the body that functions is happening through chemical messengers, communication. As long as our communication doesn't break down, our body will function perfectly normal. Unfortunately, as we age, our chemistry does break down and the communication breaks down. Like I said earlier, your hormones are responding to everything from being angry, tired, laugh, cry. They respond to sex. When you wake up, they're making you actually wake up. When you feel hungry, that's a hormone. Fall asleep, that's another hormone, melatonin and other ones. Of course, tonight we're not talking about all the hormones in the body because there are hundreds. We're limiting tonight's discussion to sex hormones and steroid hormones. The sex hormones, of course, are the estrogens. And estrogen in itself is not a hormone. A lot of people say, I've got estrogen and that's my hormone. That's not. Estrogen is a group of hormones, which you're going to learn about shortly. There's three main ones, but estrogen itself is just a title for basically three hormones. Women primarily produce more estrogen than men. Men produce more testosterone than women. But even women who produce the lowest amount of estrogen possible is still much more than men produce. The estrogen helps us with things like a stable mood, sense of well-being, feminine sexual behavior, neuron growth, and improved cognition. Men also have estrogen in their body. Not as much, but they get the same benefits that women get at a different level. Testosterone is more of the assertive hormone. It's the one that makes us be aggressive. It's a sense of separateness, which isn't always good. Aggression of risk-taking, which isn't always good. Sex drive, well, that's the same hormone. Yeah, it's always good. It's the same as the sex drive hormone is the testosterone, and women need it just as well, if not more than men sometimes. When a woman is having trouble with her sex drive, she could go to her doctor and sometimes he'll prescribe testosterone. He has to do it in very low dosages, but he will prescribe it, and it can make women more assertive, it can make them more aggressive, it can increase their sex drive, it can actually help them build muscle if they're trying to build muscle, and it can also grow hair where you don't want to grow it. So yeah, women have to be careful with testosterone. Men are not always too concerned about where they're growing hair. So some men aren't concerned. The other thing about testosterone is that it's been linked to violent crime. They find men who have been put in jail or have violent crimes and check their testosterone levels and they're through the roof. They're actually to dangerous levels. How they get there, they don't always know, but maybe it's something genetic, maybe it's something that runs in the family, but their testosterone levels are skyrocket high. When you look at, I know she's looking at that. When you look at hormones, you can actually look at hormones and kind of justify, is he more estrogen or more testosterone? Obviously more estrogen. His body is not as big. He doesn't grow very much muscle. He's kind of flamboyant. He is actually more like a woman, but he is a guy, but he's more like a woman. And there's obviously the difference between him and Hugh Jackman. And even before Hugh Jackman worked out, he was a big guy. He just made himself bigger for Wolverine. But so it's clear when you can look at someone, you can actually sometimes examine their bodies, you can look at how they talk, how they act. Their voice is also controlled by our hormones. Higher tone voices come from estrogens, deeper tone voices come from testosterone, such as in, who played Rocky? He's got an extremely deep voice. He has very high levels of testosterone to create that voice. But it doesn't mean that you couldn't take someone like Pee Wee Herman and pump him full of estrogen, pump him full of testosterone, make him work out, give him some steroids, and see what happens. I don't actually know that if that's him, but I found it somewhere. Okay, so we talked about earlier female estrogen. The estrogens are, there's three of them, estradiol, estrone, estriol. The male hormones are androgens. These are the anabolic ones, the ones that build us up, make us muscles, grow our hair, make us aggressive. Progesterone's a little different. Progesterone is a source hormone. It helps keep everything in place, everything in balance. If you don't have progesterone in your body, you can get into trouble with hormones. They can lead to problems like prostate issues. They can lead to cancer, breast cancer, ovarian, uterine. Progesterone is kind of like the guard. It makes sure that all your estrogens are in balance and your testosterones are in balance. So, and progesterone nowadays is being used for a lot of different things. It's being used to increase the lining of the uterus. As you get older, it thins out, so it's being used for that. It's being used to help women get pregnant. It can be used as a cream form where you can apply it to the abdomen, the wrists, any thin skinned area on the body. So when someone's trying to balance their hormones, it's always best to start just using progesterone. Don't run after the estrogens. Try to stay with just progesterones. They're the safest. They don't lead to any known diseases. They help with very unique functions like even cognitive functions. And they're safe. If you do choose to use any other type of hormone, like estradiol, which is the most common one, then you still have to include progesterone. Many doctors don't do that, and we're going to talk about that a little bit further into the lecture. They take the chance of, and there's a reason why they don't do it, but it can lead to problems if you don't include progesterone in your hormone balancing program. They affect our overall health. I mentioned earlier they help us think, they help us feel, they help us act. They're the shape of our body, our breasts. Intimacy comes from hormones. A lot of people have intimacy issues, and that is related to our hormones. We always wonder what's wrong with us. Well, it's not sometimes what's wrong with us, it's just an imbalance of our hormones. Once our hormones are balanced, we start feeling intimate again. It affects our eating habits. A lot of people overeat, or they comfort eat. This is hormonal. Once you get your hormones into balance, all of a sudden you're not comfort eating anymore, you're not overeating anymore. They affect your personality, so you wonder why certain people have certain types of personalities. That's from your hormones. We talked about assertiveness, which is mostly the testosterone hormone. These are the common symptoms of deficiencies or imbalances. Some of you might spot some symptoms there that you may recognize that you may have. Most of the time these are very simple to correct. As long as you address certain things, you always want to address your adrenals when you're dealing with your hormones. The adrenals are a big part of balancing the thyroid and balancing the hormones. So these are all simple to resolve, and the test that Gary was talking about earlier, the BWA, can give us some indicators if any of these things are out of range in the body. Mostly the organ systems like the liver, the thyroid, which we'll be talking about shortly when it involves the liver. The liver is one of the key factors of balancing hormones, and you'll find out why. This is the complex chemical steroid group of hormones. Obviously, we're not talking about this tonight. I just wanted you to see the difference, the amount of hormones we have in the body, and how the chain of command. If you notice, the very top left corner there, cholesterol. Cholesterol is what all hormones are made of. So we're concerned about people who take statin medications or cholesterol medications. Our cholesterol naturally goes up after the age of 35. At the age of 35, our hormones decline, our cholesterol goes up. Our cholesterol goes up to help our body make more hormones. If we take cholesterol suppressing medications, we are actually hurting our hormonal system. Doctors know this, but they have to figure out their job is to get your cholesterol down if they feel that's a problem. But it may not be. Our body responds. If we don't have enough cholesterol in the body, there are ways to increase that. The essential fatty acids help to increase that. Certain things in our diet can help us increase that. It starts with cholesterol, and if you notice, the next one in line is pregnenolone. Pregnenolone is actually a supplement a person can take, and then the body will convert the other hormones from it. You can also take DHEA, which is the one off to the center there. I try to not have people take DHEA unless they've been tested by a doctor first. DHEA in high doses can cause problems. Pregnenolone doesn't appear to cause those problems. But I can't emphasize enough, when you're dealing with hormones, if you're above the age of 40, it's important to get tested. A lot of women try not to go that route. They try to just treat their body, try to figure it out on their own. And it's really important to get tested because we can't be exactly sure where your hormones are at just by your symptoms. We have to know by the best test, of course, is the saliva test, which is going to show up in this PowerPoint in a moment. The saliva test tests you 4 times in one day. So you can see where your hormones are really falling different times of the day. It also checks your cortisol levels, which is connected to the adrenals. That's all connected together. I was talking a minute ago about the liver. Our liver has to conjugate all the hormones in our body. Your liver's over here on the right-hand side by your hip. It works across your chest over to your heart. Your liver has to synthesize or conjugate all of your hormones. Your hormones cannot work properly without your liver working properly. In fact, your hormones are actually somewhat toxic to the body. Your own hormones that you make are toxic to your own body until your liver conjugates those hormones. Unfortunately, a lot of people have liver problems. Dietary issues, alcohol, drugs. A lot of people are suffering with liver disorders. A lot of people have had hepatitis A or B in the past, and they're still suffering today with liver problems. So part of a program when a practitioner is working with you is at the very bottom, he'll treat the liver and the adrenals when he's working on your hormones. If you just take a hormone, or you apply a cream to your skin, it doesn't mean it's going to work. Even if it's the perfect hormone for you, it doesn't mean it's going to work. Your liver has to take that hormone and conjugate it to make it useful to the body and also to make it safe to the body. Any form of hormone except for progesterone can cause cancer. For men, testosterone can cause prostate cancer. For women, estradiol can cause breast, ovarian, and uterine cancer. There is no one who gets away from that if their liver is not working properly. Your liver is what protects you from that cancer, from that hormone causing the cancer. Sometimes you can tell when your liver is not working properly because a lot of people with liver function problems are also very angry people. They have trouble holding their temper. They blow up easily. They get frustrated easy. So sometimes that can be an indicator if you're having any kind of weakness in your liver. Like I said earlier, estrogen is not a hormone, it's a group. The common one is estradiol, the first one on the list, but it is also the dangerous one. The most common one, the most dangerous one. It is the one that you get when you go to a doctor for hormone replacement therapy when you're going into menopause. He will give you estradiol because it's the most active. It is the one that does the most work on the body, but it is also the most dangerous one. So again, if you're going to do estradiol, if you choose to go that route, be sure you're using progesterone. And when you bring it up to your doctor, they all of a sudden recognize that you know this, and they will recommend it for you. They have a tendency to avoid using progesterone. Only in this country. All the other countries in the world, it is part of the program. And you're going to understand why in just a moment. It has to do with the patenting process in this country of drugs. If you can't patent it, we're not going to use it. Doesn't matter how healthy it is. If you can't patent it, it's not going to work. We're not going to use it. Premarin is the one of choice that most of you, or some of you may have heard of. It's been around since 1950, about 1950, but it was also the one that showed up in the media in 2003. The media was talking about Premarin, recognizing the dangers of it, that it can cause cancer. The previous 40 years, they were telling us it doesn't cause cancer. They were telling us it doesn't cause heart disease. It supports your brain, it protects your bones. And it actually did almost all the opposite. But it took 40 years of women taking it before it was able to get released in the media. And it turns out that with most drugs, it takes 20 to 40 years before we find out the negative side effects of medication. Estradiol and estriol are the safe ones. These are the major protectors. Besides the progesterone, these are the major protectors. These are the ones that have not been shown to cause any forms of cancer. They're slower acting. They show up more after menopause in women, but they can also be used to treat any type of hormonal imbalance. And this is the reason why we tell you to do a test to find out which hormones are actually not in balance. And sometimes all the hormones are in balance and we're still not balanced because hormones have to be freed up in the body, free testosterone, they have to be freed up to work properly. So you come back from your doctor, he says all your hormones are normal, but you're still having symptoms of a hormone imbalance. That's when we focus more on the liver, focus more on using pregnenolone or progesterone, and then the body starts using the hormones properly. I mentioned earlier estradiol is one of the safer estrogens. It's a common one used topically and internally for hot flashes and vaginal dryness. It's the safer one. So for women who don't want to take the chance with using estradiol, they can use Estradiol. Most of these are available, by the way, over the counter. They're made from natural sources. They're compounded from plants, most of them, or certain foods. And this is the one that doctors don't use in the United States. Even though it's available, you'll notice at the bottom there it's non-patentable. Anything non-patentable, it doesn't matter how great it is not going to be used in the United States by medical doctors if the drug industry cannot patent and control it. Everything's about control when it comes to modern medicine in the United States. It's been used in all other countries for 30, 40 years, or even longer actually. This is the only country that medical doctors don't offer it, but it is available. Progesterone, I mentioned earlier, that's the anti-estrogen or the hormone one of the hormones that protects us from the other hormones becoming imbalanced. Men also can have problems with progesterone. It can cause swollen prostate glands, BPH. For women, irregular mens, increased inflammatory problems, breast tenderness, urinary frequency, and depression. Depression is a very common hormonal imbalance symptom. We run to the doctor, we get an antidepressant when we really don't need it. It's just a hormone imbalance for most people. It's amazing how many symptoms are related just to hormones, and we're being treated with all these other types of medications that have nothing to do with the underlying cause of the actual problem. And then we get worse, as she was saying, because we're not treating the real cause, and then we start having side effects from the medication, and when we get off the medication, we're much worse than when we actually got on the medication. Testosterone is a big problem in the United States. A lot of women and men have low T, what they call low T or low testosterone. A lot of times when we lose our elasticity, which a lot of people lose their elasticity as they age, that sometimes is related to testosterone. We lose our energy levels. Testosterone can be a real good energy booster. Of course, we talked about sex drive. That goes with the energy, goes along with the stamina. Muscle strength, especially women. As women age, they lose an enormous amount of muscle strength. They're always looking for somebody to open up the jar for them in the kitchen because they can't open it. And it's very easy to resolve. And you don't have to use synthetic products. You can use natural products that your doctor can prescribe. Medical doctors can prescribe a natural testosterone cream that's compounded in a pharmacy. Another thing about testosterone is that it helps to reverse catabolic activity. Catabolic activity, which that test can indicate, is the body breaking down. As we age, we are breaking down. Every single day, we are breaking down. But we're also building up if our body's working properly. The breaking down side produces the chemical ATP for the anabolic side to use to build the body back up. We're continually in the repair mode. If we weren't in the repair mode, we would last about 7 years. Between 7 and 9 years, we would just be dead. The body, from the minute it's born, is breaking down and building up, breaking down and building up. According to many scientists, every 7 years we have an entirely new body. Of course, the cellular memory goes along with it, so we do continue to age. But again, even with testosterone, we need to have pregnenolone in our body. Progesterone. Don't forget the importance of progesterone. There are also supplements. You don't even have to do hormones. There's also supplements that help your body produce these chemicals. I mentioned earlier one was DHEA, the other one was pregnenolone, and then there's even safer ones. There's always a safer supplement, but some of the safest ones may not do the job that we're trying to accomplish with the hormones. This is the DHEA and pregnenolone I mentioned earlier. These are available in supplements. DHEA, they can come anywhere from 5 to 100 milligrams. I see them on the internet a lot at 100 milligrams. That is dangerous for anyone. Doesn't matter what's wrong with you. It doesn't matter how low your hormones are. You never take 100 milligrams, not even long-term 50 milligrams of DHEA. For men, it causes an enormous amount of prostate stress, and they'll notice it after the first 3 or 4 weeks. They'll start having urinary retention and even losing hair. DHEA is a hormone, and the 5 milligrams is a safe dose. You can do a loading dose of 25 to 50 milligrams for a period of time. But if it was my choice, I would use pregnenolone. Pregnenolone is much safer. We got the wrong chart up. It's the very beginning after the cholesterol, and all hormones can be produced from pregnenolone. Not all hormones can be produced from DHEA. DHA is the master hormone or the parent hormone of the body. It helps initially produce some of the steroid hormones, and including testosterone. Matter of fact, testosterone is the first hormone that it produces in its chain. It also produces other forms of androgens and estrogens. And what's nice about pregnenolone is that it has neuroactive functions. It actually helps our brain work better. It gives us better cognitive functions. It helps the brain age slower. It retards all the aging in the body, but especially the brain. Most people can tell that they're on pregnenolone. All of a sudden their brain is really sharp, their memory is really clear, they're recalling information that they haven't recalled for a long time. It's very unique. Pregnenolone is a very unique supplement for improving that, including vision and many other conditions. Libido, I don't have them all listed here, but there's about 60 or 70 conditions that are aging conditions that pregnenolone works on, and pregnenolone is also one of those supplements that anti-aging doctors are using on their patients. Cortisol is an adrenal hormone. It's not really a sex hormone. The reason I'm bringing it up here is because it's part of our adrenal glands. And when people's cortisols are not balanced, when their cortisol levels are not balanced, they can have all kinds of health problems, from blood sugar problems to lack of energy to inflammatory stress response problems, hormonal imbalances. They can become estrogen dominant or deficient, progesterone deficient. They can have so many different problems when your adrenals are not working properly. And most of us have adrenal problems because we're under chronic stress or we're consuming too much caffeine. Too much caffeine is probably more than 2 mugs a day for most people. Or on the other side of the coin, we're not sleeping. Sleeping is the most important thing for our adrenals. They start to reset within 20 minutes of falling asleep. So the cat nap is actually really good for the adrenals also. If we can do a cat nap during the day, we're resetting our adrenals. If you don't get your adrenals working properly, you can take all the hormones you want and your body's still not going to correct the imbalance. Bioidentical, I'm sure everybody's heard of Bioidentical. They've been around in the US probably about 25 years. They came out initially in pill form and cream form. I prefer the cream form because it bypasses the stomach, it bypasses the liver, and you can use a much smaller amount of it. It absorbs really well into the skin, and you can start seeing results rapidly. One of the signs of needing a hormone, if you apply it to your skin, how fast it absorbs. If you apply it to your wrist, for example, and it's gone in 3 to 5 minutes, your body's absorbing it, it's pulling it in, it's needing it really fast. If you see it there 15, 20 minutes later, you can probably reduce the dosage way down to a minimal amount or do it just as needed according to symptoms. So that's one thing about creams is you can actually see if they're working for you. You can actually see the absorption. These creams help a lot of symptoms. They help you lose weight. They decrease, of course, the menopause or the andropause symptoms. And for those who don't know what andropause is, that's male menopause. Men do go through menopause. It's just different than women. We do get sweats. We do have the insomnia, the irritability. We do all that. It's just we hide it better. It doesn't show up as much on us, and we don't talk about it, but we do go through it.
Isn't that because of the women?
Sometimes it is, and it's really bad when you're both going through it at the same time. You're both creating yourselves little heating boxes in the bed, and you're both cooking, and you're trying to get away from each other because you're both so hot. I've been through it.
You just don't have to fight about
I went through it.
window.
No, you don't. All the windows can be open when that's happening. But the bioidentical hormones, men use bioidentical hormones at times for a very short period of time. It even can help people gain weight if they're underweight. It increases energy, because you got to remember, hormones don't push us one way or the other, they just balance us. And when we're balanced, if we're too far underweight, it can help us put on weight. If we're too far overweight, it can help us take off weight. So once our hormones are balanced, our whole body functions better, our metabolism functions better, our thyroid gland functions better, and then of course we start losing weight for the people who need to. And sleep. Sleep is such a critical function of the body that people who don't sleep typically, they appear to live shorter lives. They appear to age faster. They appear to have more health problems. Sleep is the only time you're leaving your body alone. It's the only time you're not irritating yourself. We are irritating ourselves all day long. The environment irritates us, our friends irritate us, our job irritates us. These bright lights can irritate some people. We are continually being irritated, and the only time that we're not is when we're in a dark room, sound asleep. Some of us are only sleeping 5 hours a night, and it's not quite enough, but for some people that will work. Once the hormones are back into balance, we start sleeping better, and all other functions of the body start to come back to normal. Again, it's about balancing certain things so other functions can come back to normal. If we try to treat all of our symptoms as symptoms, because some of us have a lot of symptoms, if we try to treat each symptom individually, we're not really getting to the underlying cause of these symptoms, and we're not correcting the problem. We're just, again, doing what modern medicine does, and that's treat the symptom. The best hormone testing is not blood. That's what we go to our doctor for, our medical doctor, and he draws blood. It is a form of testing. The best is always saliva. Saliva lets you know if the hormones are free. Blood lets you know if they're just in your body. It doesn't let you know that the hormones are useful or usable. When you do saliva testing, it lets you know if those hormones are actually usable by the body, if they're ready to go, what they call free hormones or free testosterone. But all hormones need to be freed up to work properly. The saliva testing is usually done, for the cortisol, it's done 4 times in one day. You send your saliva in on cotton swabs. Some of you may have already done this. And it'll let you know, first of all, how your adrenals are functioning, because that's critical for your hormones. And it'll also check your hormonal levels. A lot of medical doctors are now using this type of testing. They've gotten away from blood test or urine test, and they're using saliva testing to discover how balanced the hormones are. If you have a medical doctor who's not doing it, wouldn't hurt to suggest, because a lot of doctors, when they learn, a lot of doctors don't know about this stuff. Especially some of the newer doctors don't know about it. So if you recommend it to them, sometimes they'll get involved, and then they can sign up with the different companies out there. The best one is ZRT. Z as in zebra, R as in Randy, T as in Tom. It's one of the best labs out there. They've been doing it about 25 years, and they have the highest reputation for being the most accurate lab in the United States. Birth control. There's a lot of problems with birth control. It is a hormone. It is an estrogen. It makes your body believe you're pregnant. And when you do this every single month for years, the body gets recognizing that it's always pregnant. Well, the body doesn't understand when it's always pregnant what that is, because our bodies are not used to always being pregnant 24/7 for 10 years. It can cause problems, of course, cancer. We already know that birth control leads to certain cancers. Again, that's long-term use. Short-term use of birth control or any drug may not be any problem at all. But long-term use can lead to different types of cancers, different kinds of hormone problems, irregular shapes in the body. Your breast could become very large, which some people don't mind. But you can also become out of shape. Your body can come extremely out of shape. Your hips can become out of shape. Your butt may change. The shape of your body can change. So when you're dealing with birth control pills, they were meant for short-term use. They weren't meant for long-term use, even though we use them that way. And you can kind of see the common side effects here, and then the less common side effects. Now, there's a lot more side effects than this to birth control pills. The less common side effects will become the more common side effects the longer you're on them. So if you're on them for 5 years, a lot of those less common ones become the more common ones. So you can move the items that are over to the left, to the right, to the left, the longer that you're on birth control pills. There's a lot of symptoms they don't list, because there's a lot of symptoms that they don't recognize as directly connected to birth control, like, for example, not being able to get pregnant after you get off. A lot of women struggle for years to get pregnant after they get off birth control, or if they do get pregnant, they lose the baby multiple times. Other women will not come back to normal in any level in their hormones. They'll be completely thrown off when they quit using birth control pills, and then the doctors give them other hormones to try to push them back into balance. Doesn't work that way. You've got to get your liver back to normal. Your liver is the one that's been taking the beating the whole time you were on the birth control pill. Once you get the liver back into range, the liver actually tells the body when the cycle starts, it tells the body when the cycle stops. It is the bioclock of the body. So getting the liver is important. Get the liver back to normal if you want to get your body back to normal after birth control pills. There is no other way to have birth control besides that, except for condoms. But unfortunately, it is not the healthiest way to do it. In many countries, birth control pills are not allowed. The governments will not allow them to be used. They know the damaging effects of them. They also throw off our electrolytes. They can throw off our mood. They can make us extremely moody. They can actually get us into fights. It can almost act, in some cases, if you're on a long period of time, it can do the same thing that testosterone does to men. It can make you very aggressive. Now you might notice on this chart, I brought also a man chart with me also that you'll see in a moment. I didn't know if we'd have any here, but some of us can put ourselves in certain categories here. Whether you're estrogen dominant, adrenal, thyroid, estrogen, low androgen, or high androgen. And you don't have to have them all, of course. If you just had 2 or 3 in one column and you might have one over here, you look for where you have the most amount of your symptoms, where most of them fit in. And usually that's a good indicator that will match what's wrong, whether you're estrogen dominant or adrenal deficiency or thyroid deficiency. It'll let you know what's wrong. Of course, it's always good to back that up with saliva testing, or sometimes you can even use blood work, but this is just one way to do it. You're going to see another chart in a moment, but this is one way to kind of figure out where you are when it comes to the hormonal imbalances. This is also common to find out if you're estrogen dominant or progesterone deficient. A lot of women are progesterone deficient. And like, for example, women who don't have periods, they struggle for years and years and years to try to get a period, and quite often it's nothing more than progesterone. You give them a tube of progesterone and they start their period. Now, that's if they're not really athletic. If you're really athletic, that may not happen. But if you can find yourself in here or a list, then you can decide if you're estrogen dominant or progesterone deficient. You'll be able to get copies of the PowerPoint later on if you need it. Men, it's a little bit different. Some men can see where they fit into this group. I bet you a lot of them older ones probably fit into the first category, which is the low androgens, which goes back to testosterone again. Or this group over here, which is also low androgens. I mean, you can't imagine having neck pain can be low testosterone. We don't think about stuff like that. We just say my neck hurts, my muscles hurt in my neck. Sometimes it's nothing more than low testosterone. These are the hormones mostly that we talked about. Estrogen, it's a little bit more information. Some of it's just duplicated from earlier. The one that's missing is the pregnenolone, the one that I would prefer people using over the DHEA. DHEA is good to use if you need a kickstart. You need something short term, you need to start feeling better right away, or you're really suffering badly. You can use something like DHEA for short term. But it's best not to stay on it long term unless you're really closely monitoring your hormones through saliva and blood. Then you can stay on it long term. But if you do stay on it long term, it's best to reduce the dosage down to like 25 milligrams a day, like when you wake up in the morning. I still prefer seeing people on pregnenolone over DHEA. There have been some strong reports that DHEA can cause problems if the dosage is too high, and unfortunately, the internet is not always careful what it sells, and there's people out there selling 100 milligram DHEA, and there's going to be some people get into trouble with that high of a milligram. Yeah.
What's the dosage that you recommend on the
pregnenolone? It depends on it depends on the age of a person and how much they're suffering. If you want to always be on the safe side, don't go above 25 milligrams. But you can go as low as 5, and it will accumulate. So you just be patient with it and take like a 5 milli. If you can start with 25 milligrams just to get the loading dose in your body, so maybe you can start feeling changes the first week. But after you finish the first bottle of 25 milligram, it's good to go down to either 5 or 10 milligrams of pregnenolone and just take one every morning. It's best on an empty stomach. Most of the labels will probably tell you that, but it is best on an empty stomach. All supplements have a certain way of taking them for them to work the best. Sometimes the labels don't give you that information. If you go to a health practitioner, sometimes the practitioner will give you that information. You can research stuff as much as you want on the internet, but it's difficult to know what's right and wrong. There's a lot of unreliable information out there because most of the stuff on the internet is it's propaganda related to cells. It's somebody trying to sell something, so they're going to make something sound much better than it might be. And there are certain things that aren't that are sold on the internet that actually in the supplement industry don't do anything at all, but they're still sold on the internet. And there's also practitioners that don't understand certain supplements, and they will also prescribe things that really don't have much of a function in the body. But what we try to do when it comes to balancing hormones or working getting anyone's health back into order is we want to start with some type of baseline, some type of test. A lot of people do this test, which Gary was talking about earlier. It's a good test to look at things at a cellular level. It lets us know the strength of the liver, the kidneys, the adrenals. It lets us know if your body's functioning catabolic or anabolic. It lets us know the pH of the urine and saliva. It lets us know if the oxidative stress, your electrolyte balance, your carbohydrate metabolism, protein, inflammation, alkaline ions, digestion. And what's good about it is that depending on how the markers fall, it can also dictate disease. So after looking at this, for example, I'll give you an example. The carbohydrate metabolism, if it was far to the right, inflammation marker far to the right, catabolic marker far to the left, you most likely have diabetes, whether you've been diagnosed with it yet or not. If you don't have diabetes, you're on the border. This is something that can pick up medical problems before blood work can do it even. This can pick it up before that, because everything you got to remember, every disease starts at a cellular level. Cellular level diseases aren't picked up in blood work. It has to be a clinical disease at that point to be picked up in blood work. This can pick up where the weaknesses are in the body so you can prevent having those diseases, because all diseases are preventable. Doesn't matter whether they run in the family or not, they're all preventable. And so depending on which way these biomarkers fall, we can see if a person is, believe it or not, we can even tell if their chemistry is set up for cancer even. Doesn't mean you're going to get the cancer, it just shows that your chemistry is that way. Our chemistry dictates our health. If our chemistry stays too long in a certain way, certain diseases can start forming. We've all heard of acid diseases or alkaline diseases. The acid diseases are the bad ones. Alkalines are mild things, things that don't usually kill us or ruin our life. But each one of those tests, they all work off of each other. In other words, if there's 2 or 3 in a certain direction, it can dictate a certain health problem. We look at the adrenals. You'll see second to the last one's the adrenals. That one can let us, if we see that one out of range and we see the liver out of range, there's most likely hormonal problems going on. There could be autoimmune diseases going on, which can include simple things like allergies or more serious things like diabetes or Hashimoto's disease, thyroiditis. It lets us know how your electrolytes are working with your heart. It tells us how your protein metabolism and carbohydrate metabolism is working. A lot of people, they're eating plenty of carbohydrates, plenty of proteins, but they're not metabolizing them. So they're not getting their minerals, they're not metabolizing, they're not getting their alkaline ions. The alkaline ions will be low, which those people will lead to things like osteoporosis or osteopenia. They'll have nervous system disorders. They might have muscle spasms. They might have problems sleeping. People with high or low carbohydrate metabolism can have nervous disorders. They could have anxiety events. They can have depression, especially if the liver's far to the left. They can have depression events. So they all mean something. And we rely on our carbohydrates and our proteins and our food to be our medicine. But that only works if we're eating the right foods and we're absorbing the nutrients that we eat. We have a serious problem in the United States. Malnutrient diseases are really a serious problem in the United States. We're eating food, but we're not absorbing our nutrients. Or we're taking vitamins, and because they're made improperly, we're not absorbing our vitamins. Vitamins don't absorb because we swallow them. They absorb, well, first of all, your stomach has to be working properly. And then second, the vitamins have to be made right. Vitamins can be made anywhere from the Corvair to the Rolls Royce, just like everything that exists. You have high-end vitamins, you have low-end vitamins. A lot of people are just taking some vitamins that they found on the internet, and they're creating very expensive urine. Or they can read on the internet how so much of these vitamins show up in the sewer systems. You know, when they scrape the sewers every 10 years in the United States, different cities, they find just tons of vitamins in the sewer systems. Most of those vitamins are the mass-marketed vitamins, but people aren't breaking them down either because they've gotten older and they're not breaking down the vitamins in their stomach anymore, or it's just a bad vitamin. We try to avoid tablets when possible. We lean more toward capsules, but some products have to be in tablet form. But capsules break down easier, they absorb easier. But again, our stomach is our first line of defense. Your stomach is, the digestion is the most important biomarker on the test. Because when that's not working, most other things are not working. Everything starts in your digestive tract. So this is a test that the garage offers to give us a baseline where everybody's at with their health. At that point, there's an assessment you fill out at the same time, and then we kind of look over the assessment and we try to analyze what we think is going on. Now, if something we think is serious going on, there will be recommendations to go to your doctor, whoever your medical doctor might be, to do further testing, and it'll list the further testing. So it's not, we're not leaving it up to you to figure out or for your doctor to figure out. It'll tell you what tests to have your doctor run. And often it won't usually trigger those tests unless that test is confident that there's a problem. It doesn't happen too often, but it does happen. But most hormonal problems are easy to get back into balance. It's just a matter of finding out either what's wrong or recognizing what you're doing in your life that's throwing your hormones off. Does anybody have any questions? I rushed through this a little bit on purpose. I lost my voice last week.
I have a question. So, what are some of the symptoms that you would say a person would need the pregnenolone?
Cognitive. That's one of the first. When you feel a decline in your cognitive function, it doesn't matter what age, but when you feel a decline in your cognitive function, it's usually related to that particular hormone, pregnenolone. Even progesterone sometimes. It can be either or. But if you don't want to do the straight hormone, then you do pregnenolone. And let your body do the conversion. It's always good to let your body do the work. Take something, let your body take that substance and turn it into what it needs to turn it into. But then we're leaving the responsibility up to your liver. If your liver can't do it because of something that says, you can be taking all the pills you want all day long and the conversion never happens. But they see it in the blood, but the conversion never happens. So you still feel the same way you feel. So the liver is a real key element when it comes to any type of hormonal imbalance in the body.
If someone was low in luteinizing hormone, would you supplement with pregnenolone or progesterone?
It can actually be both. Sometimes it's both. Yeah, it depends on their age too, but if they're above the age of 35, it could be both. Above the age of 35, it can be both. 35, by the way, if you didn't see it, is where our hormones start, for most people, is when they start to decrease. At 35 years old, your hormones start to drop, and your cholesterol naturally goes up. It's going up on purpose. It's going up so your body can make more hormones, because hormones are made from cholesterol. So when we're taking drugs to lower our cholesterol, when I say cholesterol, I'm talking total cholesterol. When we do drugs to lower our total cholesterol, we're in a sense saying we're lowering our hormones. We're taking away the body's ability to make more hormones. So by the time if we're on statin medication at age 35 or 40, within 5 years, we're not making very many hormones anymore. So of course we need to go to our doctor. We get hormones prescribed to us. But if we wouldn't mess with our cholesterol metabolism, which also is part of the liver, if we wouldn't mess with our cholesterol metabolism, we'd continue to make the amount of hormones we're supposed to make. We naturally decrease in hormones. We have to, because they become harmful to us. But if they go too low, then we start having symptoms. Yeah?
What was the main reason why saliva is more accurate than blood tests?
In our blood doesn't show us if the hormone is active. It just shows it's there. It doesn't say that it's working or it's active. Our saliva only shows us active hormones. We're fully functional, ready to go. Blood just says it's there. It doesn't say it's workable, that it's usable, that it's gone through the conjugation process of the liver or the processing. And it's just nowadays, even medical doctors are recognizing it. The reason that everyone is not recommending the saliva testing is because it's unpatentable, and because it doesn't fall into mainstream or the HMOs yet, because there's only a small handful of labs that do it, and it can be expensive. HMOs insurance and HMOs don't like spending a lot of money on tests. Their average test they run cost them $10 or $15. This test would probably cost them over $100. Everything is controlled by insurance, big pharma, and the shareholders when it comes to our health and what state you're in. Every state is different.
Do you do the hormone test? And also, when you do this test, does this reflect on hormones as well?
This lets us know if your body can handle the hormones properly. It doesn't tell us where your hormones are at. I don't do them, but I know people that do. I know people that will I think that'll even order for anybody a hormone test without you being a patient, which is nice because it saves money. They can give you the test. Actually, I think even the pharmacy does it. I think the pharmacy will do it without having to be a patient, you know. Because to become a patient for any doctor nowadays is $300 to $400. And then they discuss the hormone test with you, another $150, where I don't think the pharmacy charges anything other than the cost of the test, which you pay direct, I think.
It's just when you need to know what it means.
Well, there's people there to help. Or you can take it to somebody else. But there's a pharmacist there who knows how to read it. It's pretty simple, actually. Yeah.
Are the strips that test your pH balance with your saliva effective and accurate?
Sometimes. There's different ones on the market. The sticks work better than the strips. But as they age, they start losing their function. When we're doing the pH testing here, that's done digital with electronic equipment. We can't rely on subjective testing. It has to be to an exact number when they're doing the testing here. But it's a way to somewhat monitor yourself as long as you've purchased good test strips and you know when to do it. You can test your urine and saliva and kind of see where it's at. You know, urine and saliva does fluctuate throughout the day. You know, in a safe zone, it might go between 6.0 and 6.99 or 7 in a safe zone, but you don't want it extremely above 7. You don't want it extremely below. You don't want it below 6 at all, actually, but because below 6 is when certain diseases can set in or try to set in. See, diseases only set in if the environment is right. They can't set in just because it got into your body a disease, like hepatitis C or anything else. The environment has to accept that disease, and it has to, the environment has to be right for the disease to last or survive. So sometimes we just change the environment by changing things on there, and whatever's going wrong, even if we don't know what's going wrong, it just goes away. Because sometimes we have a lot of things going wrong with us, we don't know what they are. They don't have a name, they're not diagnosable, because there's a difference in diagnosing. There's subjective diagnosing and there's clinical. More than 50% of all diagnosing is subjective. Doctor looking at your set of symptoms. He has no idea. He's looking at your set of symptoms and he's saying, well, sounds like you have this. We'll run a bunch of tests, but they come back normal, but it sounds like you have this. Those symptoms that you had match 30 other diseases. So how is he coming up with this one disease is by experience. It's often wrong. You can go onto the internet and type in diagnosing errors or something like that. There's a misdiagnosing or something. Yeah, there's a whole article about how poor our diagnosing is in the United States, and probably outside of the United States, but it talks about how poor the diagnosing procedure is in the United States.
Isn't a diagnosis merely a symptom anyways?
Yes.
So
it's just a symptom.
When we're treating diagnosis, we're treating symptoms, we're not treating causes.
Exactly.
That's
Like,
the biggest group.
yeah, because even if they clinically diagnose you through blood or urine and they say, oh, you have rheumatoid arthritis, they're just treating the symptom. That doesn't mean what's wrong with you. That's just a label so we can give you a drug. We have to label you before we can give you a drug. It's just the law. But it doesn't treat the cause, it's treating the symptom. So you continue to have, whether you feel it or not, you continue to have rheumatoid arthritis the rest of your life. And what it normally will do is progressively get worse because nobody's fixed the terrain that allowed it to live there. Everything is about our terrain in our body, our pH, our functions of our organ systems. Our intestines are a big part of that. People with intestinal problems wind up being sicker than people with healthy intestines. It may be partially because it's part of our digestive system, our elimination system, it's our second nervous system. Our intestines are really important besides our liver. And keeping your intestines healthy through digestive enzymes, probiotics, eating properly, yields a healthier body for most people. A lot of doctors will start there. When they don't know what to do with you, they start with your intestines or your liver. Any other questions? And if you do come up with other questions anytime in the future, you can always direct those questions to Gary or Anella. And if they don't have the answer, they will email them to me.
There's some products that you had up there.
Oh, yeah. We brought along some products just if somebody was interested in looking at a few things. Some of these are they're not hormones in themselves, but they're designed to balance hormones. For example, EvaCure, Eva as in Adam and Eve. Women, this would be used for women to balance hormones. Now that's as long as a woman doesn't need to support her testosterone, because there's one for men also. A woman can take a formula that a man would use, because women and men have share the same hormones, just in different amounts. We did bring along a DHEA. This is a chewable that a person could chew one of these a day until the bottle's empty, but at that point they would probably chew 1 or 2 a week because of the milligrams. You don't have to take DHEA every day. DHEA does store it does store in the body. If I can see. Yeah. What we brought along were things related to hormones in general, like liver, which is a product that we use for liver function to help the liver, and hepatic cure, HEPATA cure. We have, some of us know we have liver problems. Some of us don't. Or we had a liver problem one time in our past, or we had elevated enzymes, or we had hepatitis A or B or C. Some of us know we have those problems, and once you have a liver problem, even if it's 30 years ago, it's in the cellular memory. It's there forever. It's not that the problem's there forever, but there's always going to be a slight weakness there. You'll always be your weak point. Whatever happens to us throughout our life becomes our weak points. Whether it's pneumonia, whether it's lung problems, whether it's asthma, even after we get rid of the asthma, we can always get it back again. It's always a weak part of our body. We brought along a product that's for overall supporting all the glands in the body. We brought along something that supports the thyroid and metabolism. For people, this is more for someone that might be trying to lose weight. It's called Metabocure. We brought along a very unique fatty acid. There's nothing like this on the market, actually. This is the only one that exists. This is one of the only plant sterols on the market. It supports skin function, hair, nails, hormones, brain function. Most of them are made from fish, which is fine. This is one of the first ones that is made from plant. And it can even reduce pain in the body if it's inflammatory pain. There is some types of pain that are not inflammatory. It's called Estradiol FA Cure. We brought along different herbal formulas. Some of them are, for example, licorice. Licorice is fantastic for helping sometimes with estrogen deficiency problems, hot flashes. When a woman's having hot flashes, sometimes you just eat licorice and it gets rid of your hot flashes. When I say licorice, I'm talking black licorice, not red. Red doesn't work. You need, not that I'm, well, yeah, it's the glyceride, it's the chemical in licorice. So some people, if they like licorice, they'll eat licorice and the hot flashes can stop the very first day. Other people don't like licorice, they can do the extract. We brought the extract. We brought along other hormonal formulas that are just basic hormonal formulas to balance people's hormones without giving them hormones. Yeah.
So about that last thing, you said the balancer kind of thing. Is there a downside to using it? Let's say I have never had a test, I'm not necessarily sure where my hormone levels are.
You're talking about
something that just balances out.
Yeah, like Evacure. No, it doesn't hurt anybody just to take it. Nobody is perfectly balanced, and we're not even going to probably get there. But it just kind of pushes you a little bit either direction. Whichever way your body needs it, it uses the nutrients and just kind of pushes you. Now, sometimes you can feel it, because we can be more out of balance than we feel. I mean, people look at us and think we're radically out of balance sometimes, but sometimes we know it too. But a lot of people take supplements that, if they think they're out of balance, whether it's PMS out of balance, whether it's hormonal just in general, and they actually start feeling better. They take a low dose. They don't maybe go the full dose on the label, but they start feeling better. They start noticing more energy, or better brain function, or just overall feeling of ease, calmness. Sometimes that's another sign when we're not at ease or calm. That could be hormonal imbalances, where we get edgy or we're nervous all the time or stressed. Yeah, I know. The chicken or the egg, yeah.
Are all pregnenolone supplements created equal?
No. There's a huge difference in pregnenolone supplements. There are some on the market that are micronized. Micronized is a way of processing where it is a little bit easier for the body to absorb. There are also liquids out there for people who don't think they can absorb a capsule or tablet, but you're limited. There's not that many on the, when it goes on the internet, there's quite a few, but when it comes to stores, it's limited. Most of them out there are probably pretty good, but if you can get a micronized form, you have a better chance of absorbing it. We have absorption issues. We don't have pregnenolone here. We have DHA here. Pregnenolone can be a little slower acting. So DHA is further down the line, as you saw on the chart on the hormone, so it can be a little faster acting, but you don't want to use it long term, or you want a low dose after the first bottle.
Use them at the same time?
You can. I would probably do that for a short period of time and then hopefully end up with pregnenolone as what I use. Because pregnenolone is the very top of the list. It's after cholesterol. So everything can be made from pregnenolone, including DHEA. DHEA can't make pregnenolone. So, the higher on the list you go, the better. But again, that goes back to, can my body do all the conversion? Your body has to make all those conversions all the way down to estrogen, which is the last. And if it doesn't get down there, even though you're taking all the right things, if it doesn't get down to estrogen, you don't get estrogen, even though you're doing all the right things. So even cholesterol, as it converts all the way to estrogen, as it goes down the path to estrogen, again, if your body's not converting all this properly, which is more the responsibility of the liver, we're back to the liver again, then we don't convert everything. Or we don't convert enough. We always convert some. We just don't convert enough to make us feel, I guess, as normal as possible.
How about all the estrogen-like things that we take in, plastics and that sort of thing? How's that?
Yeah.
Figure in this?
It's a problem. In the last 20 years, hormones have changed radically in the United States. There's a big shift going on. Little boys are becoming like little girls. They're no longer little boys. They're becoming very feminine. Men are not as masculine as they used to be a long time ago. Especially the new men coming into the world. They're not as masculine as they get into their teenage years. There's so much estrogen in the environment now. All the plastic bottles have estrogen. Our foods are full of estrogens. We're eating soy products that are GMO. We are loading ourselves full of estrogen. One of the thing that is really standing out is that women have bigger breasts now than they've ever had ever in the history. In the last 20, well, I think it's a problem. Maybe it's not a problem, but that was the first sign that something was going on with the hormones in the world. There's actually on Netflix, you can watch a documentary that's all about the breast. And all the hormones are coming in, well, if we don't eat organic or the animals are not treated right, you'll get animal food that's full of hormones and antibiotics, which is just as bad. There's hormones showing up in our water supply because people are throwing their drugs down the toilet. There's all kinds of things that are happening with hormones now that are making us probably see more cancers than we have to be seeing. But again, as long as we support our body and our liver and doing all the right things, our body can handle a lot of abuse. Our bodies are designed to handle an enormous amount of abuse. Of course, less as we age, but we are pretty durable. We can go through a lot before we kill ourselves.
It's not us killing ourselves, though.
Well, the environment's part of we're part of the environment problem. We're drinking out of plastic bottles. We're throwing them into landfills. Maybe not you. Yeah, and I stopped doing that too. We're using a lot of plastic bottles now that end up in the landfill.
So between tap water that's running and then going through the filters that I'm afraid of, I don't know, just from everything I've heard, to the bigger bottles, like Arrowhead, what's your take on it? Because to me, it seems better than spring water, but then it's in the plastic bottle.
Well, you can get them in glass too.
BPA.
Yeah, you can get all those, or you can get BPA, which is plastic but no estrogen, and no other chemicals in there. But tap water has a problem unless you have a great filter, really great filter. It has to be able to clear out the lead, which is difficult. It has to clear out the fluorides, the chlorines. Sometimes it can get it down low but not really clear it out. Reverse osmosis can be a problem sometimes because everything's gone. So you got to remineralize the waters. Distilled, some people drink distilled. There's some people that say good and bad to that. I don't know for sure, but it doesn't seem right. But it's better just like what I've done, which I've done the last few years, is I've just finally decided I'm going to put a glass, 2.5 gallon glass in the house and just drink out of a glass bottle. I'm using Mountain Valley spring water. Great tasting water. It's completely clean. 7.0, which is what water is. Water 7.0.
When you buy it, it comes in glass.
Glass. They deliver it.
Big.
2.5 gallon. It lasts the family of 2 weeks. Yeah.
2.5 gallons.
I go through 5 a month, so it doesn't last that long. I go through about 4 a month. 4 a month. 2.5. Mountain Valley Spring. Excellent water, and they deliver right to your door. And by the time you add up the cost of buying the other waters and everything else, it's about the same. And you can keep a glass container around for your car, because what happens in plastic is that when it heats up in the car, it starts leaching the estrogens and the BPA chemicals, and it's the heat that causes it to leach more than any heat or alcohol can cause them to leach. Yeah.
What about reverse osmosis and then put the concentrates?
Some people do that. It seems to be another good way to do it. Nobody really has mastered it entirely, you know, the water situation. But we do know tap is not the best way to go. Your water's running through 100-year-old pipes, and it's also water's picking up stuff from the landfills. I mean, it's just a mess. And then they throw tons of chemicals in it to try to make it healthy. Well, they have to, because it's full of bacteria and stuff. They have to throw those chemicals in.
How do you feel about the Kangen water?
Just don't jack the pH up really high. Keep it at 7.5 or so. 7.075, and don't do it near meals. Don't drink a whole bunch before food.
Question on
Actually, we're having
takes
that problem. So the hundreds and hundreds of people we tested, one of our biggest issues is bodies over alkaline.
Too alkaline.
And it's coming up. It's probably 90% of people we test with bodies too alkaline.
And what that does, it slows the body down. Everything slows down in the body. It's not working at its speed that it's supposed to work. Bowel movements aren't coming out as fast. Everything's going slower when we do too much alkalinity. And if we do it near meals, our stomach functions between 2.0 and 4.0 acid, which is like fire. You're dumping in 7.5, 8.5, 9.5 water, and you're messing up your pH of your gut.
When you grow, everyone's pretty much over alkaline.
Not everybody. I mean, some people are acid. As we age, we get a little more acid. But I mean, if we know we're acid, drink alkaline water. If you're not acid, don't. You know, I guess that part you can test at home. You know, but I would say maybe 1 in 20 or 30 people can probably benefit from alkaline water. You know.
So there's been a lot of talk and a lot of reasons why we got to the point where we are. But the one thing I can tell you is the reason why Joseph and I brought on the labs in the first place was we saw people that had unusual body behaviors. In other words, their muscles wouldn't release. They weren't functioning properly. We would do work on them. They'd come back the next day and it looked like no work had been done. And so we started looking for other causes, and that's when we investigated for several clients who literally looked like no work had been done and brought their bodies back into balance, and their bodies just all of a sudden started to feel better. So it's not like one of the things that he mentioned on the test, excuse me, was about testosterone relating to neck symptoms. Well, it's more than just that. I mean, if your adrenals are off, your body you're not sleeping well, you go to sleep at night, your body tightens up. And you get up in the morning, here's a key indicator if you have a physical problem. If you get up in the morning and you're tighter than when you went to sleep at night, that's a key indicator that there's something off in your body. And so our whole mission has been to bring things back into balance. We started doing body work and realizing it wasn't enough. So we started doing biochemical work and started having amazing success with people because we're balancing both inside and outside. What was the use of doing all this body work, people doing yoga and everything like that, when they're fighting an uphill stream because inside their bodies aren't working properly? So this whole program about being in balance, and I want to thank Steve and George and everybody from the lab and all the work that they put in over the last year and change for us, is all about helping everybody find a new balance. We're just out of balance generally in our life. So we not only do the work here, and we do the testing, and we help bring their chemical back into balance, but we provide other services now. So even things like a massage done properly. A properly done massage actually helps your body loosen, helps your stress levels drop, and helps you actually come back to sleep. We just don't take care of ourselves correctly. And I know looking around the room, I know a lot of you. I've had this conversation directly with a lot of you. And you know people around you that are in the same situation. So tonight, as we're going to do with every seminar series, we have some specials. So one of the things is the BWE test. And one of the things that I learned was I shouldn't be taking a lot of the supplements I was taking. And I didn't know it until I took the test, because the test told me I didn't need certain things. And void of information, my strategy was I take everything. I'm serious. I used to spend $700 a month at Vitamin Shop, and I did that for about a decade. And at the end of it, I was all jacked up inside. Steve can tell you.
Oh yeah.
He's been monitoring my test.
He did good, actually. You did better than most. I mean, in a short period of time.
In a short period of
You did
time.
really good in a short period of time, yeah.
So, that whole process, we put the test on. If you haven't tested, or if you have tested, it's $200 instead of $250. The other part too is for those who haven't been through our treatment tonight. If you want to sign up and go through initial treatment, we'll do the initial session for you at $100 off. And also the body flow massage, if you want to purchase the body flow massage. Some of you guys, I think about half of you guys have had one at some point. You can get one at half price if you purchase tonight. With that, there's a few of the hormonal-based products that we'll have, but a stronger suggestion is, if you're unsure, like why would you put something into your body if you don't know exactly what it's doing, or if you need it, or what benefit it's going to have? Why not just test? And if you test, then you know. And that's really that's been our foundation with everybody. And the other thing that's been really great is a lot of times people test because they're sick. And because of the process that Joseph and Nella and I have started here, we test everybody who is willing to test. Because what we find is we want to catch people before they're sick. And if they are, and a lot of times it's a little sickness or a little problem that I had that was building up for a long time, like my digestion. My digestion was off for probably 20 years. As a result, my liver, my kidneys were off, and as a result, my adrenals started to go off too. And I know the day it switched. Do you remember that? Mm-hmm. He called me and said, "Stop taking your digestive enzymes." I'd gained like 20 pounds in a course of about 45 days, and I just couldn't figure out what happened. And what it was is that my body went from processing about 30% of what it was eating to one day my digestion flipped, and it just got better. And now, for the first time in 20 years, I don't use a digestive enzyme, which is really cool, because I've had my pockets full of enzymes for 20 years. I've ruined all my good clothes and suits because of enzymes, because they get mixed in the laundry, right? So anyways, with that being said, I want to thank Steve for being out here again. He's an incredible resource to us. Big round of applause.
Thank you.
Also, to help us spread the word, we just asked that if you haven't liked us on Facebook, like us on Facebook. We are actually open to the public starting this June. And for those of you who don't know, we're not open to the public yet. We're only by referral only. And so we're getting ready by training new practitioners, and we're starting to build a storyline, and you're going to start to see a lot of media, including a Huffington Post article coming out on us in the spring, also being written about in Buzzworthy, New York, LA Weekly, and a couple other publications you're going to see over the next couple months starting to come out, and the stories are already in the works. So we'd like you guys to support us, and if you like us on Facebook, and if you like the seminar series, the next one coming up, we'll be sending out the information on it, but it's going to be most likely the end of February. We're just going to set the date. Once again, bring somebody. We really appreciate if you do that, and also post about your experiences here, any experiences you've had with us. With that, we thank you all. Have a great night.
Thanks, buddy.